way back when I was a student, I had a lot of interest in how muscles work. And we could actually record muscle activity by putting sensors or electrodes over those muscles and monitoring what they do when people try to make movements. And you all know that the ability to make those movements is really compromised after we've had a stroke. And the muscles want to bend your shoulder, bend your elbow and wrist and fingers, seem tight or more active than the ones that go the opposite way, trying to straighten out your elbow and your wrist and your hand. So you're reaching out to grasp something. The challenge was trying to determine who can benefit. How do we know? What are the criteria that help us to understand who can best benefit from therapies? And what are the predictors for making those determinations? The factors that best predicted who, after a stroke, could gain maximal use of their upper extremity. And by use, I mean going beyond the ability to straighten and bend an elbow as to putting your arm in a sleeve of a coat or a shirt, but actually be able to control.
Yeah, we're talking function here, right, Dr. Wolf?
Yeah, manipulate the environment, and actually be able to do things. We thought at first, the big predictor here is the ability to totally relax these hyperactive muscles. And it's you all know, it's very difficult to do that. But as it turns out, what was the determining factor was not just relaxing those muscles, but relaxing them only to the point where you could begin to straighten out your elbow, raise your wrist up, and begin to open your fingers. Not necessarily all the way, just to begin to do that and to be able to repeat doing that several times. Not as quickly as you have to, but just several times over the course of a minute or so. And those